Thank you. We have a question from Diane. She's really asked a pair of questions, but perhaps one that might be useful to chew is about the working relationships between different stakeholders who might be clustering around the care of an older person, state and maybe industry provided things, things like a health system, voluntary charity organizations. When it comes to fulfilling some of those consultation-based, inclusion-based methods that you described, how does one orchestrate that inclusivity when there are so many actors who might themselves become silos, fragmented, not communicating well? Is there advice that you provide to agencies about how they need to cooperate? Is that a question, new, that's come to you out of the blue? Sorry if it's... We might not be hearing your voice.
There you go.
Oh, yeah. Okay, gotcha.
Technical issues, sorry. The thing is that the silo thing is something we try to work on, because we know that when stakeholders do not work together and really have a clear overview of what they want from each of them, it's difficult to reach a solution that is acceptable to all of them. For example, when I was listening to you, Pontus, I was wondering, this platform, was it created for the health professionals or was it created for the patients? I had more the feeling that it was created for the health professionals, well, to ease their life, to facilitate, let's say, the process. But do all patients want to be followed, let's say, monitored all the time? So it's a different, I don't know if I can provide my idea clearly, is that the perspective is a bit different. When you try to reflect this heterogeneity of all the people, you try to do that because, of course, there's a different social background, there's a different health literacy, and so on and so on. But have you discussed with all these different categories of older people, for example, when you created this platform? How I haven't followed the project, but what was the methodology behind before you created this platform?
I think this platform is to leverage the communication between the stakeholders, so it's not primarily for patients alone. And there we went through the pilot sites to discuss with their people who brought the view of the patients, and then some communication with the patients as well. But it was facilitated by the healthcare organizations, our pilot sites.
Okay.
As we focused on how to implement this whole holistic solution within these pilot sites.
All right. Deepak, sorry, your questions, I was a bit, I wasn't sure I grasped your question.
No, well, it's my fault. I'm taking a question that Diane wrote and paraphrasing it to try to make it a bit generalizable. That was all. I thought you did indicate quite clearly that you do work across sectors and try to help them to align. Because I think that the way you presented, it was very clear that somebody designing a technical innovation needs to engage with a spectrum of older people who might be users of that technology to get the heterogeneous viewpoints that might exist across that community, and then design accordingly. But there's also the complementary need that any technical innovation is almost guaranteed to introduce workflow changes within multiple actors, because it collects new data, it gathers new data, it supports the individual in new ways. And therefore, all of them need to be part of that design thinking, because it's not only designing the technology, it's designing the environment, their multi-organizational environment in which it's embedded, because that also has to be redesigned. So in the case of C3-Cloud, for example, it's not only that Pontus needs to design the PEP so that patients with multiple conditions are happy to use it and comfortable to use it and feel well informed and well empowered, but the care pathway that is being designed that embeds the patient element itself has to be sensitive to the involvement of the patient. Exactly. And designed accordingly.
Yeah.
This is complementarity, and I guess maybe it's not so much a question to you, but rather a reflection arising from Diane's question, but more is just for everyone in the audience really to take on board.
Yeah, I would like to pitch in that from your suggestions that there has to be the option of saying no, I don't want the technology, and also that in the design of the workflows includes alternative paths, that you have less for some and more for others who are more willing to use more.
Yes. So I think I don't think specifically for older people, but I also think for me, for myself, if, for example, I do not want to use technology, what is the other option? So I think that's why it's important to also ask the opinion of the user. What do you want? I know the technology is there, I know the platform is there, but how can I make sure that I will use it? Maybe not 100%, but 70%. That is enough for the platform to work and for myself to be to be able to self-manage my health at a 70% efficiency, let's say, of the platform. But you will not be able to know that I will only use it at 70% if you don't talk to me, for example.
Exactly.
So that's why I think, Deepak, you said it's important to keep this collaborative discussion with all the stakeholders, because in the end, it's not just a platform for the health professionals, but it's a health platform for local authorities because they want to reduce the costs. It's also a platform for health professionals to facilitate their work for every day, but also the patients and the citizens to be able to manage and monitor how their health is working out. So it's not just one perspective. So it's complex. It's very complex. I'm not saying it's easy.
Sarah, am I right that the next session will have a look at this area?
Definitely. Yes.
Or maybe the next but one session.
Yeah.
Sarah, I realize we've been a bit naughty and run over time again, but I thought this last exchange was really interesting. And, you know, we're not trying to close the topic here in a way. We've exposed the topic, and it's a complicated topic. It's a mission almost to take forward. Yeah. But I think that's great. I'm very pleased it came up, and thank you, Sarah, for giving us a little bit of overtime.
Thank you, Deepak. Thank you again, Pontus and you, for your presentations. So this is the end of this session.